What is a lipoma? A lipoma is a circumscribed ball of fat in the subcutaneous tissue. It's not actual fat with your regular subcutaneous tissue. It is isolated from the other subcutaneous fat from a fascia layer typically. And so that's why it can kind of ball up and move around. The good news is that they're almost always benign, but they can be tricky to remove in terms of the scar that you might need to have. And that's why they're in delicate areas like the forearms or the hands or the face. You may want to consult with a plastic surgeon. And sometimes if they're not removed completely, they can come back, okay? The other thing is that sometimes they can be intertwined into nerves, especially around the forearm and the hands. And so that's another reason to have a plastic surgeon take care of those. So we're going to do lipoma removal for our patient today. She has multiple. A lipoma is a harmless fatty deposit, and you can see that she has one here, and it's uncomfortable and annoying for her. So we're going to make tiny little incisions as a plastic surgeon here and gently remove each and every one of these. Okay, they can actually be quite delicate around the forearm because there can be some nerves traveling through them. So we have to really be careful when we dissect them not to cause any nerve injuries. Injecting some numbing medicine. This is great. It helps prevent bleeding. It also prevents a lot of pain when she wakes up. So right now we're checking for any kind of nerves. I don't see any major nerves coming through here. This is really important. You want to make sure that you don't take too much of the subcutaneous tissue because otherwise there'll be an indent here. That feels like all normal. This is a lipoma, you guys, and this is very benign. When it's mobile like this and comes out, that helps us kind of demarcate what's good and what's the normal fat and what's the unusual fat. And so we can remove that easy because it's encapsulated. That's it for our lipoma removal, you guys. You want to take a look here. These are what a lipoma is, and they can vary in consistency, but you saw for her they were pretty well encapsulated. We're able to remove those in block and then close that up nice and neat. We're going to send it to pathology, make sure there's no concerns there. A couple small incisions so that she'll have a couple lines, but her skin type is very favorable for minimal scarring. We're going to use our scar protocol using our scar shield strips once it's healed and get our stitches out at week 1 and week 2, okay? Feel free to leave your comments, questions, feedback right here on my YouTube page, and hit thumbs up and subscribe if you like what you saw today. Thanks so much.